and he collapsed, he fainted, and the nurse was heard saying that I do not feel a pulse. So basically, the hospital administration, the employees of Brain Lungs Hospital have basically killed my husband, Prashanth Sreekumar.
A lot of you have asked me to comment on this recent incident where a 44-year-old man and a father of 3 presented to a Canadian ER with chest pain and elevated blood pressure, waited more than 8 hours, and died. And I've been hesitant to speak on this for 2 reasons. First, there's an open and ongoing investigation, and I don't have all the facts. And second, out of respect for his wife and family, I don't want to appear opportunistic or like I'm trying to benefit from a man's tragic death. Yes, I am a Canadian ER doctor, and I can imagine what happened on the floor that day, but without all the details, anything that I say about this specific case would only be speculative. But at the same time, I do understand why people are outraged by this outcome, and that everyone wants to understand how something like this could have happened. What I can speak to more generally and based on established standards of care is how patients with chest pain and elevated blood pressure are typically triaged. Even with a normal initial ECG, cases like this are usually assigned a triage level of 2 or 3, meaning that they're expected to be assessed by a doctor within 15 to 30 minutes. What's also very well supported by evidence is the danger of long ER wait times. Decades of research clearly show that long wait times are associated with worse patient outcomes, including a higher risk of death. And in situations like this, people often look for a single scapegoat, and frequently that ends up being the physician who is ultimately assigned to see that patient. And I genuinely feel for that doctor, because responsibility in cases like this is rarely that simple. You would need to examine the decisions and handovers of every physician involved over the preceding 8 hours, and you would also need to look at the state of the ER itself, specifically how many beds were occupied by admitted patients, a problem known as bed blocking. Because when ER wait times are extreme, it's often because bed blocking is high, and that forces doctors to assess and manage patients in hallways and waiting rooms. This isn't a failure of frontline doctors and nurses, it's a failure of hospital throughput and system-level capacity. My heart goes out to the family of Prashanth Sreekumar during this incredibly difficult time. I hope that they get answers and closure. And I also hope that the frontline clinicians working in the ER receive more support and that they're not unfairly scapegoated for a system that's failing around them.